Good morning, everyone. I hope you guys are all having a good day. For a little while, I want to step away from gastroparesis and talk about a few other diseases, chronic illnesses. Please feel free to continue asking questions about gastroparesis if you have any, or feeding tubes or anything like that. I'm willing to answer any questions, do a video on anything that you guys want. So, if it's not requested, my next few videos are going to be about a couple of other chronic illnesses. Again, feel free to ask any questions. I do want to talk about Ehlers-Danlos syndrome, dysautonomia, dystonia, and adrenal insufficiency, which I suffer from all of those. So I can give you a little bit of an insight to them. Today I want to talk about dysautonomia a little bit more. I introduced it, I think a couple of weeks back, maybe my second or third video. Just a reminder, it is a malfunction of the autonomic nervous system. The autonomic nervous system controls everything like your heart rate, your blood pressure, your sweating, your digestive system, just everything like that. If you don't have to think about it, that's most likely what's controlling it. So a lot of people can have heat intolerance. Like I have heat intolerance, and it's literally 1 degree can make a huge difference for me. It can be 70 in my room. As soon as it gets to 71, I start to get extremely hot. I start to sweat. My body starts to shake, and my blood pressure drops, and I start to feel like I'm going to throw up. Other people can have the same problem with cold intolerance. And then your body can also just have this inability to control temperature at all. So I've woken up plenty of nights, or even during the day when I'm sitting here, I'll start shivering like I'm cold, and then I'll start sweating at the same time because my body just cannot control that temperature. Another thing that dysautonomia does for me is it keeps my heart rate really high, which is called tachycardia. Tachycardia, for most people, a resting heart rate is in about the 60s. My resting heart rate is usually 110 to 120. So that would be you getting up and doing a mild activity, jogging down the stairs, running out to your car and coming back, something like that. That's my resting heart rate. When I stand up and walk, it goes even higher now that I'm moving and doing an activity. So we want to try and bring that down. We tried a medication for it, and it actually lowered my blood pressure, which made things dangerous for me. The opposite of that is called bradycardia. Your heart rate is too low, and I've dealt with bradycardia a couple of times, and it just feels like death. When your heart rate is beating 30 beats per minute, or 20 beats per minute, you don't feel like you're alive anymore, and it's just such a sickening feeling. The other problem that I have is my blood pressure. My blood pressure is way too low. My typical blood pressure is like 90s, maybe 105 up to 105 over 60s. Normal blood pressures are higher, and typically when I stand up, my blood pressure may drop. I've had it go as low as like 80 over 53, sometimes where I'm aware that it's that low. Goes any lower, you can have syncope, you can just pass out. So since medications were not working for me, we decided to start doing saline infusions at home. This is just a typical bag of saline water. Saline water is salt water, but this does have sugar in it because I do have problems being hypoglycemic, and potassium because my potassium tends to run low. But that is the best thing to do for someone who has really low blood pressure, is to get hydrated and eat salty snacks, because the salty snacks are going to retain the water or retain fluids and increase how expand your vessels so your blood flow is more normal and your blood pressure should go back up. So the only reason that I can do saline infusions at home is because I have a port. Now usually my port doesn't look like this. There would be no gauze here and no gauze here. I've had my port since May of 2013, and for the past 3 weeks they could not get blood out of it. So I had it checked by interventional radiology yesterday, and my port had gone bad, so we changed it. So there's an incision up here where the port is inserted, and then this right here is used to tunnel the catheter into my vein, and that leads directly into my heart. So first and foremost, anything you're doing with a port, a central line, a PICC line, you want to make sure your hands are clean and sterile, because you do not want to introduce bacteria into those lines to get an infection, because it leads straight to the heart, and that can be a very, very big problem. So first thing I'm going to do is use some hand sanitizer. And now this right here is a Heber needle, and the Heber needles are changed once a week. If it's not changed once a week, it becomes an infection risk. So the Heber needle and the cap all come separately. This does have two, but we only use the one cap because I only do infusions of saline. This would come in handy for like chemo patients if they're doing chemo in one and saline in the other, or things like that. We don't put a second cap on this one because we don't want to open it up and open it to infection. Now, there's a kit that comes with it. You have a pair of gloves in it, a sterile drape to drape over the patient, ChloraPrep sticks. They're swabs, and it's like alcohol but stronger. So they use 3 of those to clean the area to make sure there's no bacteria. There's also a skin protectant pad. It makes that area, it forms a little film over your skin to protect your skin a little more. Plus it makes it stickier so that your dressing stays on longer. And it comes with Tegaderm, like this. This Tegaderm for me is really bad because it'll literally burn my skin. So if you get a central line, a port, or a PICC line, it's going to be trial and error until you find a dressing that works for you. I've tried a whole bunch, and we finally figured out that this dressing here, IV3000, was the best for me. There's different versions of the IV3000, and so this one is a little bit bigger. It's about this size, but there are smaller versions. IV3000 has a few different types, but it's one of the best for sensitive skin. So now, since I have my port accessed, I have my saline out, and it's warmed up pretty much to room temperature now because it stays refrigerated. The first thing that I'm going to do is prep the line. So I do mine by gravity, which means it drips just by gravity. No pump pumps it out. You can get a pump for fluids, but for most of the time it's not necessary. I do mine at night while I'm sleeping, and when I wake up I just flush my line. So we're going to open up the gravity line. First thing that you want to do is you want to close the clamp. Because if you do not close the clamp, the second that you spike it, everything is going to come out. The next thing that I do is I take the cap off of this, and now for like ports, typically you can just screw this on to the port. Or, I'm sorry, for PICC lines you can screw this onto the PICC line. But for mine, it's like an IV at the hospital. Something has to go in, so they send that piece with me. This piece does not get taken out until it is ready to be put on to this piece, and that cap that was on there does not get taken off until it's ready to go on this piece. All for being sterile. Sorry. Again, because you don't want to introduce bacteria. So once that's in, at the bottom of the saline, there's usually a little plug. You're going to take the plug off, and you're going to take the cap off of this, and you're just going to spike it. And typically spiking it while it's on the pole is easier, and all I do is I just twist it in. And then you're going to squeeze this right here a couple of times to get a little bit of water in there. And I'm going to go ahead and take that off so that it's unwrapped. And the next thing you want to do is you want to prime the line, because you don't want to put air into your veins. So typically I prime the line into one of the bags, like this, or the bag that the saline comes into. So all I do is I open the clamp at full force, and it'll start to drip water into here. There we go. So it's dripping some saline in. So now it's completely primed. So I'll close the clasp back up, and I'll hang it right here. The next thing that I have to do is I have to prep myself to be hooked up. First and foremost, that would be getting your flushes. So I use a saline flush. To get the saline flush open, you kind of have to like pop it from the bottom, and then you can twist the cap off. And then again, the way my port works, I actually have to have a needle on it to get the flush in, rather than just twisting it on like you would with some PICC lines. So I get the needle twisted on, and I make sure all the air out. The next thing that I want to do, and I do this most of the time, when I do a lot of the times when I do my saline, I'll do IV Zofran at the same time, since I'm already going to have my port primed. So here's the cap for that, or here's the vial for the IV Zofran, and the syringe that they send me. We're going to pop this off, and usually that's on to keep it sterile, but if you guys watched Tori's TPN video, you know that we still scrub it with alcohol. I'm going to turn it upside down, and then pull some air back into my syringe. And then once I get it in, I'm going to push the air into the syringe and just let it suck it all out. The last few drops in here. For some people, it's not a big deal, but this is like liquid gold for me. It's one of the few things that works for my vomiting and nausea. So I try and get every single drop that I can. And usually there's like a huge amount that's stuck at the top that I try and get out. There we go. So that's done. I'm actually going to take, oops, I hope if I put the right cap on. Okay, so I'm actually going to take this cap off and put the same cap that I use for my flush. Get that ready. And the way you do any medication, you do flush, medication, flush, and then generally you do heparin, but since I'm not doing heparin, I'll be connecting directly to my infusion. So I'm going to prep another saline. Again, you just push it until you hear the pop, and you can twist it off. Get all the air out of this one. Okay. So the first thing I'm going to do is grab some alcohol wipes. And scrub the hub very well, because you don't want any bacteria on it. Get the flush, unclamp it, and just push the flush in. I'll clamp my line again. Get a new alcohol swab. Scrub the hub again. They usually say for 15 to 20 seconds, I believe. And this is my Zofran. I only used one vial. And that one vial is only 4 milligrams of Zofran. Get another alcohol wipe. Flush my Zofran in. Clamp this closed again. One more alcohol wipe. And we're ready to get connected. So we're going to grab this. And again, this cap never comes off until you're ready to connect to it. Again, to make sure no bacteria gets in it. So now I've unclamped it. And it just connects to my port like so. And now I'm ready to start my fluids. All I have to do is make sure this is unclamped and open up the clamp here to the rate of how fast I want the fluids to run. I can get this bag in under 2 hours if I wanted to, or if you raise it high enough and open the clamp all the way. But for most people, especially with their who have blood pressure issues, doing at least 3 hours helps better than doing it really quickly, because if you run your fluids too quickly, you're just going to need to go to the restroom, and you'll end up peeing it all out, and it's just not going to be helpful for you. So once you're done with your saline, all you have, what you're going to do is flush with one more saline flush. So I usually get that prepped ahead of time, and that I'm doing right now. So I'll flush with this, and then I flush with my heparin. And this will keep my port from getting any blood clots. That way it stays viable. And that's it. Needles and the vial, I'll go into the into my sharps container. To save room, I usually just take the needles off and throw these away. So again, like I said, the needles in the vial go in my sharps container. The rest of the stuff is trash. And the lines, your gravity lines, can actually be used for 72 hours. So you can use it 3 days. So what I usually do is I take the cover of the spike and I will tape it to the bag that I'm using currently. And I also take the cover to this orange piece so that when it's done I can cover it back up. And if you do reuse the line, you would change that orange clamp portion every single time. So that's it. That's how I manage my heart rate and my blood pressure. I don't take any medications. Getting this port and being able to do these saline infusions at home have helped me tremendously. My heart rate is lower typically. If I get enough fluids in, it can actually go into the 80s rather than being 120 or 130. And then my blood pressure will usually be about 110 over 70 if I have enough fluids. If I feel that my blood pressure has dropped on me, there are some days that I'll do 2 bags rather than 1. I get 4 bags a week, and my cardiologist stated if I need more fluids than that, give her a call and she'll send me to the infusion center. But that's the beauty of this. I don't have to sit in an infusion center for 4 hours waiting for the saline to come down. You know, I get to do it in the comfort of my own home. I can go anywhere I want because I have it on my IV pole. And it's a lot easier than that, than doing it at the infusion center. Other people get pumps, so they can take theirs with them. I've actually taken mine with me before, and I hook it to those little hooks that they put on the handrails of the car on the ceiling, and it works just fine. It still drips the way it's supposed to, and I get my fluids that way. And then wherever I get to, I'll find a way to hook it, whether it's to a lamp, to a random screw on the wall, anything, and finish it there, so it doesn't keep me at home. But at the same time, it is nice to be able to lay in my bed, watch what I want on TV, do what I want, and not have to be at an infusion center for this. Again, I cannot stress how much you need to be sterile with all of this, because again, it goes straight to your heart if you have a port. It goes straight to your heart if you have a central line, whether it's a Hickman, a Broviac, any central line. It goes straight to your heart if you have a PIC. If you get an infection, it can be deadly. You can become septic, and it's scary. You'll be in the hospital for so long, and again, if you don't realize it fast enough, or you don't have a home care nurse that comes out, or you don't have a doctor that you'll see regularly, you can end up dying from it. So you want to make sure your hands are clean. You want to make sure that everything that you use is clean. That way you don't get an infection. So I'm going to go off and finish my infusion for the day. Let me know if you guys have any questions. I hope I was able to teach y'all something, and I hope y'all have a great day. Thank you.